afternoon. So good afternoon, everyone, and welcome to eHealth Initiative's Digital Health Equity Summit. I'm excited to be with so many providers and patients, administrators, technology experts, and public health practitioners that are gathered here today to learn about how maternal telemedicine practices and digital tools have been used during the COVID-19 emergency health crisis. You've heard all my titles in Congress. I don't think she missed one, but I also speak to you today as a mother of two, a stepmother, and a grandmother. I have leveraged my position in Congress and drawn from my experience as a mother to mobilize my colleagues to address health inequities, most notably the maternal mortality crisis. Despite spending 17% of our GDP on healthcare, the rate of maternal mortality in the United States is higher than that of any other developed country. Until the maternal mortality issue stops claiming the lives of birthing people, I will continue to remind everyone that each year, 700 Americans die from childbirth and pregnancy-related causes. Many of these deaths are preventable, and they often occur between 43 and 365 days postpartum. While we have seen many major advancements in healthcare over the last few decades, women of color and women living in rural communities continue to suffer the most. Across the country, more than 50% of rural women live more than a 30-minute drive away from the nearest hospital offering perinatal services. Black Americans make up 8% of the rural population and 40% of the 5.2 million people who identify as Indigenous live in rural areas on and off tribal lands. The shameful result of reduced access to care, among other factors, is that Black and Indigenous women die from pregnancy-related complications at 3 times and 2 times the rate of their non-Hispanic white counterparts, respectively. The COVID-19 pandemic required us to use telemedicine to minimize patients' exposure to the virus while continuing to provide much-needed care. This allowed pregnant and postpartum individuals who face geographical and socioeconomic and various other barriers to care to stay connected to their healthcare team. New and expecting mothers use telemedicine to submit weekly blood pressure readings and weights to the electronic health record using smartphones. Providers employed solutions at the intersection of maternal and behavioral health, such as MCPAP for moms to provide real-time perinatal psychiatric consultations and resources for referrals to effectively prevent, identify, and manage pregnant and postpartum patients' mental health and substance use issues. As we continue to modernize and make use of digital medical tools to address maternal health concerns beyond the COVID-19 pandemic, it is so important that we ensure these tools are being developed for and made available to the individuals who need it most. In Congress, I have championed policies in the Mamas Act that center health equity, improve data collection, extend Medicaid coverage for new moms, and encourage increased education around how racism, stigma, and bias show up in healthcare. However, the Mamas Act was developed in 2018, long before the COVID-19 pandemic. While the policies in that bill need to become law to improve the lives of pregnant women and new moms, we have to also work to ensure that digital health tools that have become more popular during the pandemic remain accessible to everyone. To help in this effort, I have called for improving the availability of broadband so that patients living in rural areas with limited access to internet connection do not have to forego critical health services. I have also introduced the Evaluating Disparities in Outcomes in Telehealth Act to make sure policymakers have the data necessary to design equitable telehealth policies. This bill will require the Secretary of HHS to study the impact of telehealth on utilization, cost, fraud, privacy, and equitable access within the Medicare and Medicaid programs during the COVID-19 emergency. The study would also include a summary of telehealth utilization data, such as the number of telehealth visits, whether they were audio only or in-person visits, disaggregated by service type and demographic characteristics. A study like this would ensure that innovators and entrepreneurs, such as the talented individuals we have on today's panel, would have the information they need to continue to develop the tools we need to address the maternal health crisis, among other major health issues. Thank you so much again for the opportunity to speak to you today, and I look forward to collaborating with all of you to eliminate the maternal mortality crisis. Thank you so much.